Ladies and gentlemen, may I request you to rise as our chief guest for today's program, the Honorable Union Minister for Health and Family Welfare and Chemicals and Fertilizers, Dr. Manshukh Mandaviyaji, has just entered the auditorium. He is being accompanied on stage by Dr. Tamilisai Soundararajanji, the Honorable Lieutenant Governor of Puducherry, Shri N. Rangasamy ji, Honorable Chief Minister of Puducherry, and our respected Director, Professor Rakesh Agarwal. May I also request Shri R. Selvam ji, Honorable Speaker, Legislative Assembly, Puducherry, Shri S. Selvaganapati ji, Honorable Member of Parliament, Rajya Sabha, Shri V. Vaithalingam ji, Honorable Member of Parliament, Lok Sabha, Shri V. Arumugam ji, Honorable Member of Legislative Assembly, Puducherry, to kindly grace the dais. Thank you, ladies and gentlemen. Please take your seats as we begin the program. At the outset, may I request our respected director, sir, to felicitate our esteemed dignitaries on the dais. Move. To begin proceedings, ladies and gentlemen, may I invite all of you to join in the invocation of Lord Dhanvantari, the physician of the gods. I entreat all of you to rise for the rendition of the invocation song.
धन्वन्तरी स भगवानमृतत्वदाता योगैद्यकस्य गुरुरादिरनादिकालात् योगार्थदेहमनः आत्मसुखावहस्य नैरोग्यतस्य निधरां चन्द्रिणां हितस्य तस्य हृणस्पदमहर्षिवरस्य शिष्य ये देवयं प्रमुदिताननुभाग्यवन्तः तेन प्रदीपितचरं सुचिरात् शुभायु वेदस्य दीपान्मिह तत्पुरतो दरामः हेम प्रभावय इतत्यहितस्य दिक्षुम् ज्योत्स्नामृजार्तिशमनीं भ्रमवेम दातुम् या दिव्यदात हृदयाय हि मानवाय द्वेयं द्विधं भुवि कलापि जनाखिलैष्यः द्वेयं द्विधं भुवि कलापि जनाखिलैष्यः द्वेयं द्विधं भुवि कलापि जनाखिलैष्यः.
Thank you very much for that soulful rendition. Ladies and gentlemen, please take your seats. I now request all the dignitaries on stage to join in lighting the ceremonial lamp. Lighting a lamp before a ceremony spreads divine grace. The lamp also shows everyone who is present how to rise upwards and dispel darkness. And after all, fire is one of the 5 elements that form our body. I request all the dignitaries to join in the lamp lighting, please. May I now request I now invite our director, Professor Rakesh Agarwal, to formally welcome all our guests for today's event.
Vanakkam, Namaskar, good morning. Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, and our chief guest for today, Dr. Mansukh Mandavia ji, our guests of honor, Honorable Lieutenant Governor of Puducherry, Dr. Tamilisai Sundararajan ji, and Honorable Chief Minister of Puducherry, Shri N. Rangaswamy ji, Honorable Speaker of the Puducherry Assembly, Shri R. Selvam ji, Honorable Members of Parliament and members of the Institute body, Shri Vethalingam ji and Shri Selva Ganpati ji, Member of the Legislative Assembly, Shri B. Arumugam, and Honorable Minister of PWD and Tourism, Puducherry, Shri Lakshmi Narayan ji. Other guests, representatives from the media, and several attendees on video conference. On behalf of President of JIPMER, the entire JIPMER family, and on my personal behalf, I am pleased to welcome you to this function to dedicate to the nation the JIPMER International School of Public Health, or JISPH, by our Honorable Chief Guest, Dr. Mansukh Mandaviya ji, the Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers. Our chief guest today is a youth icon known for his commitment to public service, passion for taking the government to the doorsteps of the common man, and speed in implementing major changes. He has very impressively led the COVID-19 vaccination drive of the country, and that is how we have been able to fight the COVID pandemic. We are very proud to have a person of his stature, an astute statesman, to dedicate this new facility in the field of health. We are grateful to you, sir, for your visit. To talk a little bit about JIPMER, Jawaharlal Institute of Postgraduate Medical Education and Research, or JIPMER, is a premier healthcare teaching institution with 8th rank overall among all medical institutions in the country in the NIRF rankings, and 5th among institutions that provide MBBS training. Besides education, it provides high-quality healthcare to nearly 8,000 outpatients every day and 2,100 inpatients. The School of Public Health was conceived to bring in the highest level of education and research in public health. Its building, being dedicated today, was completed at a cost of rupees 65.6 crores during the pandemic and could not be inaugurated earlier. The building has state-of-the-art facilities and houses the Department of Preventive and Social Medicine. New posts, 92 academic and nearly 50 of support staff, are under active consideration of the Union Ministry of Health. The school runs a 2-year Master of Public Health or MPH program and will admit its 9th cohort this year. Of the more than 150 trainees who have completed the course, most have found placement in reputed national and international organizations, including the World Health Organization and UNICEF, etc. A health technology assessment center supported by the Department of Health Research, Government of India, is also functional and undertakes activities related to health economics. The objectives of JISPH are in sync with various health initiatives of the Government of India and our Honorable Prime Minister, such as the Prime Minister Ayushman Bharat Health Infrastructure Mission and National Health Mission. Thus, this school, will play a vital role in expanding public health capacity, not only in the region, but also in the entire country. Our Honorable Lieutenant Governor, Dr. Tamilisai Sundararajan ji, is an administrator with a unique ability to connect with people from all walks of life. I have had the good fortune of a close interaction with her during her weekly meetings on COVID and was impressed with her quick decision making. I am grateful to you, Madam, for gracing the occasion and joining us today. I also welcome our Honorable Chief Minister, Shri N. Rangasamy ji. A true son of the soil, he cares deeply for the well-being of Puducherry and all its people. Sir, your presence today honors us, and we are very grateful for you to have accepted our invitation. We are also grateful to Honorable Speaker, Shri R. Selvam ji, Honorable Member of Rajya Sabha, Shri S. Selva Ganpati ji, Honorable Member of Lok Sabha, Shri V. Vathilingam ji, Member of the Legislative Assembly for Indranagar constituency, Shri V. Arumugam, and Honorable Minister of PWD and Tourism, Puducherry, Shri K. Lakshmi Narayan ji, for being with us and giving us their good wishes. They have always supported the Institute in its various endeavors, and today I am grateful for their having come here and graced the occasion and given us their best wishes for this new project that we are going to dedicate today. I also welcome our other guests today who are in the audience and or are on video conferencing. They have all been our well-wishers and helped the Institute in myriad ways, and your joining today is also very encouraging for us. In the end, let me say, we all know prevention is better than cure. The School of Public Health is a step in this direction to promote the trinity of public health: prevention, protection, and promotion of health. I am sure that with the wishes of this august gathering, the Institute and in particular the JISPH will be successful in fulfilling these objectives. Thank you, Nandri.
Thank you very much, sir, for providing the prologue to the JIPMER International School of Public Health. Today witnesses the dedication of the JIPMER International School of Public Health to the nation by our Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Dr. Manshukh Mandaviya ji. May I request, sir, to kindly do the honors?
The Jawaharlal Institute of Postgraduate Medical Education and Research, or JIPMER, was started in 1823 by the then French government and was the first medical school in India. The JIPMER International School of Public Health, or JISPH, was conceived with the objective of providing the highest level of education, training scientists and practitioners, and to prepare leaders in the field of public health. JISPH was established with several state-of-the-art facilities in a total built-up area of 12,625 square meters at a total project cost of 65.6 crores. A total of 92 academic and other supporting posts have been proposed to render all the planned services. The school has several facilities such as the auditorium, lecture hall, and other learning hubs which are located in the middle block and are flanked by 2 divisions on each floor. The school will house 7 divisions. Each division, within its subject area, will focus on offering formal, need-based academic training, generating sustainable, scalable, and replicable solutions to public health problems, building capacity among existing health professionals, and generating healthy debate on public health policy and developing advocacy tools, and working in close collaboration with the Union Ministry of Health. Currently, the Department of Preventive and Social Medicine is functioning from the JISPH building. The school has also been running a Master of Public Health academic program and a Health Technology Assessment Center supported by the Department of Health Research, Government of India. The objectives of JISPH are in sync with the various health initiatives of the Government of India and our Honorable Prime Minister, such as the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission and the National Health Mission. The school will play a vital role in expanding public health capacity in the country as well as in the entire Southeast Asia region. Today, we are grateful to our Honorable Union Health Minister for dedicating the JIPMER International School of Public Health to the nation.
Thank you very much. May I now invite our Honorable Chief Minister of Puducherry, Shri N. Rangasamy ji, to address the gathering, please.
அனைவருக்கும் வணக்கம். ஜிப்மர் சர்வதேச பொது சுகாதார பள்ளியை தேசத்திற்கு அர்ப்பணிக்கின்ற இந்த விழாவிலே தலைமை விருந்தினராக கலந்து கொண்டு சிறப்பித்துக் கொண்டிருக்கின்ற மரியாதைக்குரிய மாண்புமிகு மத்திய சுகாதாரம் மற்றும் குடும்பநலத்துறை அமைச்சர் அவர்களே, அன்புக்குரிய மேதகு துணைநிலை ஆளுநர் அவர்களே, எனது அன்பிற்குரிய மாண்புமிகு சட்டப்பேரவைத் தலைவர் அவர்களே, மாண்புமிகு பொதுப்பணித்துறை அமைச்சர் அவர்களே, அன்பிற்குரிய பாராளுமன்ற உறுப்பினர்களே, அன்பிற்குரிய சட்டமன்ற உறுப்பினர்களே, ஜிப்மர் மருத்துவக் கல்லூரி மற்றும் மருத்துவமனையுடைய மரியாதைக்குரிய இயக்குனர் அவர்களே, பேராசிரியர் பெருமக்களே, அன்பிற்குரிய மாணவ செல்வங்களே, எனது இனிய நண்பர்களே, உங்கள் அனைவருக்கும் என்னுடைய நன்றி கலந்த வணக்கத்தை தெரிவித்துக் கொள்கிறேன். இந்த இனிய விழாவில் கலந்து கொள்ள நான் மிகுந்த மகிழ்ச்சி அடைகிறேன். இது ஜிப்மருடைய ஒரு அடுத்த மைல் கல் என்று சொல்லலாம். ஜிப்மர் சர்வதேச பொது சுகாதார பள்ளி, புதுச்சேரி ஜிப்மர் மருத்துவக் கல்லூரி மற்றும் மருத்துவமனை உலக புகழ்பெற்ற ஒரு கல்லூரியாக, மருத்துவமனையாக இருப்பதை அறியும் பொழுது மிகுந்த மகிழ்ச்சி. புதுச்சேரி அமைந்திருப்பது என்பது, இங்கே படித்து செல்கின்ற மாணவர்கள், இந்த மருத்துவக் கல்லூரியில் படித்து செல்கின்ற மாணவர்கள் மிகவும் புகழ்பெற்ற நிலையில், புகழ்பெற்ற கல்லூரிகளில், மருத்துவமனைகளில், பல வெளிநாட்டு மருத்துவமனைகளில் பணியாற்றுவது என்பது மிகவும் பாராட்டுக்குரிய ஒன்று. எத்தனையோ மருத்துவர்கள், சிறந்த மருத்துவர்கள் வெளிநாடுகளில் இப்பொழுது பணியாற்றி கொண்டு வருகின்றார்கள். அப்படிப்பட்ட ஒரு சிறந்த மருத்துவக் கல்லூரி நம்முடைய ஜிப்மர் மருத்துவக் கல்லூரி புதுச்சேரியில் அமைந்திருப்பது மகிழ்ச்சிக்குரிய ஒன்று. சிறந்த மருத்துவ வசதியும் கொடுத்து கொண்டிருக்கின்றது. இப்பொழுது ஜிப்மர் சர்வதேச பொது சுகாதார பள்ளி தொடங்கியிருக்கின்றது. மிகுந்த மகிழ்ச்சி. என்னுடைய எண்ணம், ஜிப்மர் மருத்துவமனை மேலும் விரிவான நிலையில் அனைவருக்கும் மருத்துவ வசதி என்ற எண்ணத்தில் பணியாற்ற வேண்டும் என்பது என்னுடைய எண்ணம். சின்ன சின்ன சிறிய சிறிய குறைகள் இருந்து கொண்டிருக்கின்றது. அனைவருக்கும் மருத்துவம் என்ற நிலையில் பணியாற்ற வேண்டும், மருத்துவ வசதி கிடைக்க வேண்டும் என்பது என்னுடைய எண்ணம். இந்த மருத்துவமனையில், நம்முடைய ஜிப்மர் மருத்துவமனையில் வந்து செல்கின்ற நோயாளிகள் மிகவும் பயனுள்ள வகையில் சிறந்த மருத்துவ வசதி கிடைக்கும் என்ற ஒரு எண்ணம் எப்பொழுதும் இருந்து கொண்டிருப்பதை நாம் பார்க்கின்றோம். சில நோய்களுக்குரிய மருத்துவ சிகிச்சை என்பது காலம் கடத்தாமல் இருக்க வேண்டும் என்பது என்னுடைய எண்ணம். சில நோய்கள் உடனடியாக கவனித்து குணப்படுத்த வேண்டிய கட்டாயம் என்பதும் நாம் அறிந்த ஒன்று. அந்த நிலையில் அனைவருக்கும் உடனடியாக சிகிச்சை கிடைக்கின்ற நிலையில் நம்முடைய ஜிப்மர் மருத்துவமனை சேவை செய்ய வேண்டும் என்று கேட்டு, இந்த ஜிப்மர் சர்வதேச பொது சுகாதார பள்ளி எல்லோருக்கும், பிள்ளைகளுக்கு பயனுள்ள வகையில் அமையும் என்று கூறி வாழ்த்தி, வாய்ப்புக்கு நன்றி கூறி விடைபெறுகின்றேன். நன்றி, வணக்கம்.
It is my privilege now to invite our Honorable Lieutenant Governor Puducherry, Dr. Tamilisai Soundararajan to deliver her address.
A special good morning to each and everyone here. First of all, I thank our Honorable Minister for Health and Family Welfare, Honorable Sri Dr. Mansukh Mandaviya ji, for visiting Puducherry and visiting JIPMER. At the same time, inviting him, and I thank all the doctors, staff, paramedics, nurses, all the medical fraternity for helping the Union Territory of Puducherry and also the people from districts of Tamil Nadu for helping us to combat the pandemic. And I, from the bottom of my heart, I thank each and every one of you for serving the state. And Honorable Chief Minister, Honorable Speaker, Honorable Minister of Tourism and PWD, Honorable MPs from Lok Sabha and Rajya Sabha, Honorable Member of Legislative Assembly of this constituency, Honorable Dr. Rakesh Agarwal, Director, JIPMER, and all the medical fraternity and all the dignitaries who have assembled here. JIPMER International School of Public Health. They have translated in a very good manner Tamil. JIPMER Sarvadesa Sugadara Palli. For that I congratulate you because you are serving the people from Puducherry and Tamil Nadu. So they should think that this institution is nearer to their heart. So translating it in the very beautiful language of Tamil, I really congratulate you. At the same time, my request is, whatever may be the programs here, along with the national anthem, Tamil Thai Valthu should be there. That is, without intention, most probably, it would have been omitted, and Tamil Thai Valthai Therivithu. And hereafter, we have to honor our country and honor the language with the people who are all you are serving. Something should not be projected negatively in spite of serving the state in a much with service mind. And as it is said, Jawaharlal Institute of Postgraduate Medical Education and Research and the International School of Public Health. And as it is projected, now this International School of Public Health is going to sharpen our efforts in the medical field. So the innovation and inventions is going to help us to serve the people in much better way. And not only that, because the school will ultimately consist of 7 divisions, that is communicable, non-communicable, and research in the maternal and child welfare, and so on. And particularly, this will be a bridge to facilitate the Ayushman Bharat. I always thank our Honorable Prime Minister, not only as a citizen of this country, as a doctor, when practicing in the government hospitals and seeing the patients in the private institutions, seeing the sufferings of the people, for them to face the medical expenses. So whenever Honorable Prime Minister introduced this Ayushman Bharat, which is the largest insurance scheme in the world, serving more than 50 crore of the population, and when it was introduced, within 90 days, 6 lakh people underwent cardiac procedures. That indicates how the people were in need of such insurance schemes. And as a gynecologist, I thank our Honorable Prime Minister because most of the insurance schemes don't include the cesarean sections. And for including the cesarean sections and even the first child, when it was born, when 9,000 rupees was given to the gynecologist, to the hospital, and it includes the hospital bill, the pre-admission and the post-admission, even the investigations, the room rent, in such a grand insurance scheme. So I thank our Honorable Prime Minister for such a good insurance scheme, and this institute, International Institute, will facilitate the reach of this Ayushman Bharat. So whatever may be the multiple uses for this institution, but primarily when it's going to reach the people and facilitate the Ayushman Bharat, I really thank our Honorable Minister for Health for coming here and to lay the foundation for this institute. And the medical health, particularly during the pandemic, JIPMER, I know how, as Professor Rakesh Agarwal said, I should appreciate him. Every Thursday we had meeting to discussions and got the guidance from different specialities and different hospitals. Even we have private hospitals, government hospitals, professors. And I should say that every meeting, every Thursday without fail, he attended the meeting and he gave guidance for all of us with his rich experience. So I thank the JIPMER for all of you because of all of your help. And whenever there was a request from the government during the pandemic, actually you fulfilled all our desire. But as our Honorable Chief Minister said here, there are some setbacks. If an institution is that, there could be setback. And my request is that should be corrected. The availability of drugs, the availability of the medical professionals, and quickening of the procedures, whatever maybe we would have faced. It's medical challenge. As a doctor, I understand. But for the people, our service should be extended in much better way. And these research activities, as the director said, the research activities really help not only the state, this union territory, not only the adjacent state, but the whole country. So many research papers. And when we were about to introduce the plasma therapy also, then the research from you helped us for better guidance in dealing with the plasma therapy also. So what all the research activities, I really thank you all for all the research activities and thank you for serving this state. And even though the fraternities from multilinguistic states, but you are serving the people from Puducherry and Tamil Nadu, and I really thank you for all those service you are rendering to the people. And as Lieutenant Governor of Puducherry, I thank you all, and I particularly thank our Honorable Mansukh Mandaviya ji for guiding us during the pandemic and guiding us for taking the message of vaccination to the people. Actually, when I came here, the vaccination was just 4,000. And now Puducherry has crossed 17 lakh doses. So with all the efforts, and as it is said, the WHO itself lauded the work of our ASHA workers. The Indian ASHA workers did exemplary job in taking the message of vaccination, and because of his motivation in Puducherry, we went house to house for motivation of vaccine. During that, we had bitter experience also. They locked the door, they climbed on the trees, and they were abusing us. But in spite of that, because of the message from the central government, from the Honorable Prime Minister and from the Honorable Minister, we took the message of vaccination to each and everyone. Because of that, the nation is safe, and the state is safe, and the Union Territory is safe. Thank you so much.
Thank you very much, Madam. It's now my distinct privilege to request our chief guest, Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Dr. Manchuk Mandaviyaji, to deliver his address to an expectant audience.
On occasion dedication of JIPMER International School of Public Health, sitting on dais, Her Excellency Lieutenant Governor Tamilisai Sundaram ji, Honorable Speaker R. Selvam ji, Honorable PWD Minister ji, both MPs, Lok Sabha and Rajya Sabha, sitting on dais of all dignitaries, student, faculties, deans. Today, as I address this young gathering of doctors, experts, and faculty, it gives me immense joy, knowing very well that the health of the nation tomorrow is good hands. Today also marks one of the most important days in the history of public health management in India. Having dedicated the International School of Public Health to the nation. This world-class institution will not just cater to our country, but also to the entire world. Keeping in tandem with the Indian philosophy of Vasudhaiva Kutumbakam. This center will provide education and training in its first with its state-of-art infrastructure to the student. Government of India has allocated rupees 65 crores to this unique project. We have seen how under the able leadership of Shri Narendra Modi ji, India spearheaded the fight against COVID and developed a strong and robust mechanism to counter public health issue and emerged successful in the management of this pandemic. I urge students to ambassadors of health and compassion and treat every human with empathy. Thank you.
Thank you very much, sir. We are much obliged to have you in our midst today and have had the honor and pleasure of listening to your views. I now request our respected director, sir, to present mementos to our dignitaries on the dais as a mark of our immense gratitude to all of them for having graced this program together with their inspirational presence. Thank you very much, sir. As we progress towards the end of today's official program, I now call upon our respected Dean Academic Professor Pankaj Kundra to propose a vote of thanks.
வாழ்வினில் செம்மையை செய்பவள் நீயே, மாண்புகள் நீயே, என் தமிழ் தாயே, வீழ்வாறு வீழாது காப்பவள் நீயே, வீரனின் வீரமும் வெற்றியும் நீயே, தாண்டிடு நிலையினில் உனை விடுப்பேனோ, தமிழ் என் நாளும் தலை குனிவேனோ, சூழ்ந்தின்பம் நல்கிடும் பைந்தமிழன்னாய் தோன்றுடல் நீ உயிர் நான் மறப்பேனோ, செந்தமிழே உயிரே நருந்தேனே, செயலினை மூச்சினை உனக்களித்தேனே, நைந்தாயனில் நைந்து போகுமென் வாழ்வு, நன்னிலை உனக்கெனில் எனக்கும் தானே, முந்திய நாளினில் அறிவுமில்லாது மொய்த்தனன் மனிதராம் புதுப்புனல் மீது செந்தாமரை காடு பூத்தது போல செழித்த என் தமிழே, ஒளியே வாழி, செழித்த என் தமிழே, ஒளியே வாழி, செழித்த என் தமிழே, ஒளியே வாழி.
It's my pleasant duty and privilege to stand here on behalf of the entire JIPMER family and express our deep gratitude to all our guests. First and foremost, we express our deepest gratitude to the Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, and our chief guest of today, Dr. Mansukh Mandaviya ji. He followed up on his promise to visit JIPMER, and I thank him for inaugurating the JIPMER International School of Public Health. His youthful energy and commitment to public service have always inspired us. We thank our Honorable Lieutenant Governor, Dr. Tamilisai Soundararajan ji, for her presence here today and for the immense support and strength that she lends to everyone in Pondicherry. We know that she has a special corner in her heart for JIPMER, and for that we are ever so grateful to you, Madam. We thank Honorable Chief Minister of Pondicherry, Shri N. Rangaswamy ji, for accepting our invitation to be our guest of honor. We at JIPMER have had a long association with him, and his humility, leadership, and service-mindedness have always inspired us. We look forward to his advice and support in all our endeavors. Our special thanks to the Honorable Speaker of Puducherry Legislative Assembly, Thiru R. Selvam ji, Honorable Member of Parliament Rajya Sabha, Thiru L. Selva Ganapathy ji, and V. Vandelagwan ji, and the Honorable Member of Puducherry Legislative Assembly, Thiru V. Armungam ji, for gracing the occasion. We are also extremely thankful to the Honorable Minister of Public Works Department and Tourism, Shri Lakshmi Narayan ji, for gracing this occasion. I, and on behalf of JIPMER, thank Mr. Nilambuj Sharan, Joint Secretary of Ministry of Health and Welfare, who has specially visited Pondicherry on this occasion for his valuable guidance and support. We are thankful to the esteemed institute and governing body members and to our past faculty members who have imbibed the virtues of compassionate healthcare in all of us at JIPMER. My special thanks to HLL and Heights for bringing to life the JIPMER International School of Public Health, which was dedicated to the nation today. I thank all the representatives of the print and electronic media for covering today's event and for helping us reach out to the public at all times. To conclude, all the members of JIPMER family are deeply grateful to all our guests and well-wishers who have come together today here. Your presence and your recognition of our efforts mean a lot to us. There are many who have contributed to the culmination of this day, and it is impossible for me to list each one by name. But please, know that you all have touched our heart by your sincere devotion and hard work as always. Thank you. Jai Hind.
Thank you, sir. Ladies and gentlemen, we have now reached the end of today's official program. I now beseech you to rise for this rendition of the national anthem.
हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Ladies and gentlemen, may I request you to please kindly remain standing in your places till our chief guest and other dignitaries exit the auditorium.
It's impossible that all peoples together, all dignitaries is here, so its questions answers is not good. You want to ask any questions? All students sit down. Please, you have any given to numbers that who is student is want to ask? Are you okay? हैं? नीचे आके बात करने में I have no problem. I comes to there.
Yes, sir.
Okay. Please. Remove your mask.
So, good afternoon, sir, first. So my question is that there is a lot of violence in the country against doctors, nurses, other healthcare workers. So can there be a national law that can actually protect these doctors from these healthcare workers or medical staff from this kind of violence?
That's a good question. During COVID crisis, we have passed the law. During pandemic, any patient and any person, the good behavior to doctors, violence to doctors, we have taken to decision, passed the resolution in Parliament that we have taken to action against him in strong. But lastly, number of Doctors Association of India, National Doctors Association, and individually, and number of hospitals read to letter to central government. So we decide that we in a futuristic time, coming time, we as a minister come in Parliament to strong law against violence of doctors.
Thank you, sir.
Kashuki.
Okay, you stand there.
Good afternoon, sir. I'm Kaushiki.
You remove the mask.
Sir, my question is that is it possible to bring in a regulation to control the prices of drugs and devices so as to bring down the cost of healthcare, especially in the private sector?
Controlling the price of drugs and devices by the government so that the cost of treatment comes down, especially in private sector.
It's neat. We are working about it. It's good questions. हम कर रहे हैं.
So we'll go to our first MBBS student, Sonit. Sonit, can we quickly pass the mic there? Pass from there.
So my question is, how do you think an interdisciplinary approach will work in medical education in India? Say, exposure of students to electives in biophysics or bioinformatics in partnership with perhaps top Indian and international institutes of science and technology. Will that be feasible?
What you want to say?
कि कैसे हम जो प्योर साइंस इंस्टीट्यूट हैं स्टूडेंट्स को साथ साथ वहाँ भी काम करने को अलाउ कर सकते हैं.
नहीं, ये रिसर्च इंस्टीट्यूट के साथ स्टूडेंट को काम करने की अपॉर्चुनिटी मिलनी चाहिए. नाउ वी हैव पास द पॉलिसी इन ICMR that and IIT, all IITs, the student is working there, student is research there. During educations, during government job, they are doing research, and this research is utilized to convert to commercialize. They can get to partnership also. So ICMR's policy is approved. Pharmaceuticals policy is ongoing, that any student work in pharmacy college and they have research to any medicines, they work in any medicines, and you are doctors, you are work in hospital, you are during your services, you have research, you publish to papers, you have research any things, you have modified to medical device, you suggest to other type of practice. So it is your right, and government should given to relief about your work. You are given to some time, you spend time in research, government gives to opportunity to that. This type of subject we are working, not only for working, but we are start to take in decision. 1, 2, 3 decision is done, and other decisions will be ongoing.
Sir,
Thank you,
if
sir.
I may intervene and bring in a faculty member, Dr. Sitanshu and I were discussing something related in the morning. Sitanshu, you want to ask that as a question? We were wondering whether government wants to do something. I'm sorry, sir, to bring in a faculty member.
Don't worry.
Yes, good afternoon, sir. I am Sitanshu. I work in the Department of Preventive and Social Medicine. Continuing that question, so research is our skill, but it takes a lot of time and effort and energy. So my question to you is Government of India thinking about giving some incentive to people or the researchers who are working in these institutions such as JIPMER, AIMS, and somewhere else, sir? So is there a provision of providing some incentives to people who are doing research in this areas?
उसमें मेरा सुझाव ऐसा है कि रिसर्च में आपको इंसेंटिव दे, उसके अलावा आपको इंस्टीट्यूट में काम कर रहे हैं तो रिसर्च के लिए आपको अपॉर्चुनिटी वहाँ है, लेकिन रिसर्च के बाद उसका कमर्शलाइज करना है, उस वक्त आप उसका पार्टनर हो सकते हो. नाउ इन टुडेज पॉलिसी इज नॉट there that you have any research, you want to commercialize, any companies comes to you, approach to you and your institute, they buy your research and they start to manufacturing this type of research, base of research. तो आज के दिन में उसके लिए कुछ नहीं है, लेकिन हम उसको पार्टनरशिप देने के लिए, ताकि आप जाके उत्साह से रिसर्च करेंगे, और रिसर्च करने के लिए वी आर गिविंग टू इंसेंटिव टू इंस्टीट्यूट, नॉट इंडिविजुअल. इंस्टीट्यूट वाया गो टू रिसर्चर्स ऑल्सो.
सर टाइम तो आपका हो गया, पर एक क्वेश्चन और ले सकता हूँ. सौहार्द्यानंदी.
Good afternoon, sir. I am Shohardhan Nandi, third year MBBS student. My question is this. Medical students in our country across institutions are frequently facing severe mental health issues and suicide rates are very high, sir. Can you please take up this cause and try to provide a solution to this nationwide long-standing issue, sir? Thank you.
मुझे लगता है कि निमहांस के लिए आपका ज्वाइनिंग कराना पड़ेगा. NIMHANS is a working on mental health. Now and today, during COVID crisis, the ratio is going high, but average 12% to 15% people suffer to mental health issues. So, as our requirement, we should do the consultation with student. हम यहाँ अपनी कॉलेज में, इंस्टीट्यूट में मेंटल हेल्थ के प्रोफेसर हैं.
सर साइकेट्री डिपार्टमेंट,
साइकेट्रिक
के अलावा हमने स्टूडेंट्स के लिए एक स्टूडेंट वेलफेयर सेल बनाया है, जिसमें कि काउंसलर्स हैं. वो डीन के ऑफिस वाले फ्लोर पर खुला है. उनके हेल्पलाइन नंबर है, उनका ईमेल एड्रेस है. वो जब तक कॉलेज खुलता है उसके लेट तक खुलता है, ताकि कोई जिस समय क्लास चल रही है उस समय नहीं, अलग समय पर जा सकता.
बट मुझे लगता है कि उसको निमहांस से टेली कंसल्टेशन स्टूडेंट को अपॉर्चुनिटी देनी चाहिए, क्योंकि ये टिग्मा होता है. वो बाहर आके स्टूडेंट सभी फ्रेंड्स के बीच में से आके नहीं कहेंगे कि माई सेल्फ इज सफ़र टू दिस टाइप ऑफ इश्यूज़, मुझे इस टाइप की मन में विचार आ रहा है, मैं ये करूँगा, ये नहीं हो रहा है, मैं स्ट्रेस में इसलिए रहता हूँ, मुझे ये होता है. वो सीधी बात नहीं करेंगे कभी. और मैं तो आई थिंक दैट इट्स नॉट टॉक विथ योर साइकियाट्रिस्ट, बट you give the opportunity to teleconsultation with NIMHANS, they consulted with him. ये करना चाहिए.
बहुत बढ़िया. It is a very good suggestion. We'll try and work on that.
Thank you.
Sir, thank you, sir. I am getting a signal कि time हो गया हमारा.
Yes.
Here. Please.
So previously, I am Dr. Ravindran, Professor of Pharmacology. So previously there were only few INIs as the medical colleges are concerned. Now there are so many aims and INIs like JIPMER, PGI, Chandigarh and NIMHANS and so many of these things. Now, I would request, please constitute a committee to assess the competence, performance and the progress of the, progress are made by the administration for each college. So if you constitute a committee or some kind of system, so that they can measure all these things, competence of the administration and what performance, what is their performance and what progress they have made. And if you do this, definitely this standard of this INIs will definitely they will improve. And please, you start with JIPMER, sir. Thank you, sir.
That's a good suggestion. Now we are starting to command and control center in NMC. They are all medical college. CCTV cameras is joining with command and control room in central NMC. Timely they are looking to all type of situations. They are used to artificial intelligence that this NIMHANS medical college all room have a camera joining with central command and control rooms. Student faculties, which type of studying to student and faculties, and which type of surgery is ongoing, how number of patient is coming, and any patients have any grievance, all type of, and they are consulted with faculties, colleges, all type of system we are creating in National Medical Commission. So regularly this type of platform useful to assessment of all medical colleges, all इंस्टीट्यूट हु इज़ वर्किंग ऑन मेडिकल सेक्टर, उसके लिए हमने बहुत अच्छा एक सिस्टम क्रिएट किया है। वहाँ से बैठे बैठे मैं आपसे भी बात करूँगा कई दिनों के बाद कि चलो मुझे लगे कि चलो मैं यही टीम के साथ इंटरेक्शन करना है तो मैं एनएमसी में कमांड एंड कंट्रोल रूम में जाऊँगा, वहाँ बैठ के कहूँगा कि ये क्लास में इतने स्टूडेंट आज आए हैं, फैकल्टीज़ वहाँ थी नहीं, स्टूडेंट बाहर चले गए, वहाँ पेशेंट रो में थे, कई पेशेंट को ट्रीटमेंट में बहुत समय लगा है, इस टाइप की ग्रीवेंस है, या तो जो भी आपकी इंस्टीट्यूट की एक्टिविटी टाइम टू टाइम ऑब्जर्व करने के लिए सिस्टम क्रिएट किया है। क्योंकि मेडिकल एजुकेशन और मेडिकल स्टूडेंट को बेस्ट एजुकेशन मिले बहुत आवश्यक है, और बेस्ट एजुकेशन के लिए फैकल्टी चाहिए, पेशेंट चाहिए, और टेक्नोलॉजी भी चाहिए, इंफ्रास्ट्रक्चर भी चाहिए। तो जहाँ है वहाँ ही मेडिकल कॉलेज चलेंगे, नहीं है उसको मैं चलाना नहीं चाहता हूँ। धन्यवाद।
थैंक यू सर।